Okay, so good morning, students. So in the last class, we have discussed about superficial thrombophlebitis, which was the abnormal vein that you will find, and in thrombophlebitis you will find there, and in thrombophlebitis you will find two types of abnormalities in the vein. Those are superficial thrombophlebitis, and the second one is deep vein thrombosis. And in superficial thrombophlebitis, in which part of the vein abnormalities occur. Obviously, it will be superficial, right? Superficial vein. So today, deep vein thrombosis. So from the name itself, in which part of the vein will the abnormality of the vein occur? In which part of the vein? Can anybody say? Yes. In which part of the vein will the abnormality occur? Occur. Deep vein
Ma'am,
or
in deep vein.
yeah, deep vein. Okay. So today we will be studying about that. Okay, so this is a deep vein thrombosis. So deep vein thrombosis usually occurs in the deep vein. Understand? So same thing, this one also, this is the normal blood flow. So the normal blood flow is in this manner. So the blood will flow in this direction, that is in the upward direction, which will go towards the heart. Understand? But in deep vein thrombosis, the function will be abnormal. It won't be normal. So what will happen? So in the deep vein thrombosis, there will be a blood clot. Blood clot. Blood clot means what? Means accumulation of the blood. All right, accumulation of the blood. Why? Because the valve is weak. Okay, the valve is weak. The vein is weak. The veins got damaged. That's why it can't function properly. It can't function normally. So that's why there will be occurrence of blood clot. Is it clear? And this deep vein usually occurs in the leg portion. All right, in the thigh portion, in the lower leg, in this area. Okay, is it clear? Clear this portion, everyone? Yes or no? Okay. Okay. So what are the signs and symptoms that you will find in deep vein thrombosis? Means if a person is having a deep vein thrombosis, what are the signs and symptoms which you will be able to see? First is heaviness and swelling of the leg. Okay, why the person will feel heaviness and swelling? Because there is blood clot inside the leg, inside the thigh. Got it? So that's why the person will feel heavy. The person will feel his or her leg very heavy, and as well as it will swell up. Next is pain and tenderness. Means the person will feel pain. It's not that obviously there is some inflammation. If there is any inflammation in any part of your body, obviously you will feel pain, right? You will get hurt. So there will be pain or tenderness. Tenderness means very much sensitive. That portion, the place where the person will feel pain in that affected area, the person in that area means it will be like tender, it will be sensitive. Okay, next is skin discoloration and ulcers. So skin discoloration and ulcers, same thing. This one also it usually occurs. Why? Because there is blood clot. Understand? There is inflammation. So that's why skin discoloration and ulcers also occur. And this one is a warm sensation. So the person will feel a bit warm, means in the leg portion, means a bit hot. Understand? It will, the person will feel hot in the affected area. And the person will feel pain mostly in the calf muscle, CALF, calf, this portion. And the person will feel cramps or else soreness. Cramps means uh, contraction of muscle. Understand? Contraction of muscle, or else soreness. Soreness means same thing, pain. Understand? So the person will feel pain in this area, that is the calf muscle. Another sign and symptoms is same thing, this one also, but I'm just repeating again. Swelling of the leg or calf, this portion will swell up as well as, yeah, it will swell in the leg. Thus, you can say calf muscle. Next is pain. The person will feel pain, especially if a person is standing or walking. Understand? Because the person is giving pressure, right? The person is giving pressure when a person is standing or walking. That's why the person will feel pain. Understand? Next is warm and redness. So the skin color also it will turn into red color, and this portion also it will become hot. Warm. Is it clear about the sign and symptoms, everyone? Tumpe Jilan, is it clear? Is it clear, Trishna and all? Trishna, Surajit.
Yes, ma'am.
Okay. So these are the signs and symptoms that you will find in deep vein thrombosis, also known as DVT. Okay, this one also same thing. From the femoral vein, it will occur with thrombus. Understand? It will swell, it will be warm. So same thing, further repeated. Okay. Another sign and symptoms that you will find in this deep vein thrombosis or else DVT is pulmonary embolism. So what do you understand by pulmonary embolism? Pulmonary embolism means uh, and this is the blood clot, right? From thrombosis it occurs. Understand? So this blood clot it will break. I mean the part of the blood clot which is known as embolus. Embolus. Okay, this is the blood clot. So what will happen? With the help of the vein, with the help of the vein, this embolus or else the blood clot, it will go upwards in the upward direction. In the upward direction, it will go, and when it will reach upside, when it will reach upside, so in which part it will reach? So in the lung, it will reach here. Understand? It will reach here in the lung, and obviously there will be some blockage, right? Because the blood clot it will go and enter in this place, it is lung, and since the lung and the heart they are connected with each other, means they are nearby each other, so obviously it will get affected. The lung and the heart, both these internal organs or visceral organs, they will get affected. So obviously, uh, the person will find difficulty in what? Difficulty in, can anybody guess? If there is some blockage or if there is something in your lung, means or else in your heart portion, right? So the person will find difficulty in what?
Breathing.
Yeah, the person will find difficulty in breathing. Understand? Okay, Rudolph, good. Okay, so these are the symptoms that you will find in pulmonary embolism. First is sudden chest pain that worsen with breathing. So obviously the person will feel pain, all right, because there is some abnormalities going on in the lungs. So that's why the person will feel pain in the chest, and of course the person will find difficulty in breathing because the lungs helps you in breathing, inhaling, exhaling, internal respiration, external respiration, right? So that's why the person will find difficulty in breathing. Okay, next is sudden shortness of breath. Means same thing. It deals. I mean, this one is also like a part of breathing. So the person like will find difficulty in breathing. Same thing. Okay. Next is rapid heartbeat. So the heartbeat also it will be very much rapid. It will be very fast. Next is rapid breathing. So the person also will feel. I mean, when the person will breathe, also the person will breathe like very much fast, not normal breathing. Next is sweating. Obviously, the person, if there is some normality is going on, the person will sweat, right? Because of the normality is going on inside him or her. So the person will sweat. Next is anxiety. The person will be very much anxiety. I mean, very much tense, you can say, very much, yeah, tense. Next is coughing up blood. So coughing up blood, why it usually occurs? Because there is embolism, there is the blood clot. So if the person will give force from inside, if the person gives force from inside, obviously the blood clot by that force, by that forceful motion, you can say, by that forceful motion, what will happen? Uh, the blood clot will automatically like come out. So that's why coughing up blood occurs. Okay, is it clear? Next is fainting. The person might obviously there are so many things going on inside him or her. So obviously the person will be very much tired. So ultimately the person might faint. The person will feel unconscious and sometimes the person might faint also. Next is heart palpitations, means the heart will beat very fast, same thing. And next is signs of shock. So signs of shock. Why signs of shock will occur? Because shock, why it usually occur? Shock, it usually occurs because there is less blood circulation in all the parts of the human body, right? So there is less blood circulation. So that's why shock might also occur because of this pulmonary embolism. Okay, is it clear?
Yes, ma'am.
Okay, about this shock also now, like we will study in the next topic because it deals with the blood circulation. That's why. Okay, I hope everyone is clear. Okay, next is same thing. I'm just showing you in picture. That's why picture is a bit easy to understand, right? So that's why I'm just showing it you in picture system wise also. Okay. Unexplained sudden breathlessness means the person will find difficulty in breathing. Okay. Next is sharp, sudden sharp chest pain. So the person chest will pain. Okay. Next is coughing up blood. So the person will cough out blood because there is blood clot inside. Understand? So the pulmonary embolism. So if when the person will give force, the blood clot automatically like it will come out. So that's why the person will cough up blood. Okay. So another syndrome is post thrombotic syndrome. So this is the post thrombotic syndrome. Here it's more clearer. Here it's more clearer. Okay. Post thrombotic syndrome. Okay, what happens here? Because of the reduction of the blood clot, okay, because of the reduction of the blood flow in the leg, what will happen? It will get affected, the leg portion. So that's why what will happen? Swelling will occur, skin discoloration will occur, and skin sores will also occur, means pain. So these are some pictures. These are some pictures. Okay, is it clear? Okay, next is risk factors. I mean, if means how can a person have this deep vein thrombosis? Means why it usually occurs, like at the risk who are at the risk of having this deep vein thrombosis. Okay, next first is cancer. So if a person is having cancer, and you know why cancer occurs? First thing, students, anybody, why cancer occurs? Anyone, why cancer occurs? Anyone have any idea? No. Yes, someone. You dog?
Abnormal growth of cell.
Yes, abnormal growth of cells. Very good. Okay, so there are some abnormalities in the growth of the cell. Understand? Like abnormal means what means more than the requirement. You can say more than the person's requirement. Cell. Okay, the this cancer occurs. Okay. So because of cancer also the person can have this deep vein thrombosis. Next is smoking. If a person smoke too much, understand? So obviously it will hamper the lungs, right? So pulmonary embolism, it relate with that thing also. So it will hamper. Next is long-term use of hormonal drugs. So long-term use of hormonal drugs, if a person if a person consume too much of uh, all those no, contraceptive medicine, understand, like eye pill and all those things. Okay, so what will happen? Obviously, there will be some hormonal changes going on, right? So that's why the vein thrombosis occurs. Okay, next is prolonged bed rest and prolonged sitting. So if a person sit in one particular place or if a person rest in some particular place for too long, so there will be what? There will be uh, poor blood circulation, right? Because the person is not moving. The person is not moving. The person is sitting or lying down in one particular place for so long. So obviously there will be some, uh, blood circulation won't be normal. It's not it. So that's why this deep vein thrombosis occur. Okay, next is pregnancy. So in pregnancy time, what happens? Because of the hormonal changes, understand, because of hormonal changes as well as weight gain also, you can see that because of this reason the vein thrombosis occur. Next is injuries and fractures of the leg. Okay, so if there is some injury or if there is some fracture in the leg, what will happen? Obviously something is breaking inside your body, right? That is your bones. So there will be blood clot, there will be bleeding, internal bleeding, of course. So that's why, because of that reason, this deep vein thrombosis occur. Okay, next is varicose vein. So varicose vein also we have studied in the previous class, right? So varicose vein also, if a person is having like varicose vein, the person will be at the risk of having DVT. Okay, next is obesity, that is overweight people. So overweight people also, like they are at the risk of having DVT. Understand? Because if a person is too much overweight, if a person sits, then obviously there won't be blood circulation. The blood circulation won't be reached. Understand? The person should perform instant exercise, all those things. So that's why the person, this kind of person, that is obese people, that is overweight people, they will be at the risk of having this DVT. Next is over 60 years old, means elderly people or aged people. So the aged people, they are at the risk of having DVT. Why? Because during this time, the veins become weak. Understand? The veins become weak and the veins usually get damaged. So that's why the person will be at the risk of having DVT. Same thing, this prolonged standing also is somewhat similar. Okay, next is genetic predisposition. So this genetic predisposition, what happens? It usually occurs genetically also. Understand? It occurs if your forefathers, your uncle, auntie were having, so the person will be at the risk of having DVT. Next is injury or surgery. So if a person is having any injury or else if a person performs some surgery, so obviously there will be cutting, right? So the blood clot will arise. So that's why it will occur. Next is stroke. Stroke. Understand? Stroke also same thing because of poor blood circulation in the human body. Stroke occurs. So that's why stroke person or stroke people are the person who is having stroke. They are at the risk of having DVT. Next is heart failure. So if a person heart failure, uh, it will come along as pulmonary embolism, that is PE, right? Because there is poor means blood clot It's not it. So that's why there will be poor blood circulation. So obviously there will be heart failure, and because of that reason, DVT can also arise. Okay, is it clear, everyone, about the risk factor? Who are at the risk of having DVT? Yes? Yes or no? Okay. Next is prevention. How can a person prevent himself or herself from not getting this DVT? Okay, first, obviously, the person have to lose the weight because of that obesity. Yes, and next is exercise. The person should perform exercise. Why? Because exercises gives us, they used to be rich of blood circulation. That's why. Understand? Next is comfortable shoes. So the person should wear some comfortable shoes also. All right. So that there will be, what to say, blood circulation will be rich. That's why. Next is physical exercise. The person should also perform physical exercise also for uh, blood circulation. Next is avoid harmful habits. Avoid harmful habits like what? Mm, like if a person is having alcohol, if a person is having what to say, smoking, alcohol, smoking, tobacco, all these things. The person should avoid all these bad habits. I hope it's clear. Okay, and the person can perform like this kind of exercise also. First is foot pump. The person should suppose this is the foot. The person can like this pump like this. Understand? Like this, like this, like this, like this. Okay, next is knee lifts. Knee lifts. What will happen? The person can lift the knee of the right side. Understand? And again, left, right, left, like this. Okay, next is chair leg raise. The person can raise the leg like this. One, two, one, two, like that. Okay, next is ankle circle. So this is the ankle. So ankle circle, what will happen like this? Okay, like in this manner, the person can perform that is kind of exercise. Okay, next is foot exercise. Foot exercise means only the foot. Okay, first is the person can point the toes like this and like this, stretching like this. Next is lift toes upward. The person can lift the toe upwards like this in this manner. Okay. Next is clench toes. So like this. In this manner, the person can perform. Okay. Next is spread toes. So in this manner, the person can spread his or her toes. Next is rotate ankle. So the person can rotate ankle like this. In this manner. Next is starting with legs outstretched, alternate behind each leg at knee. So the person can fold his or her leg, okay, one at a time. First right side and the other left side. So one at a time, the person can perform this exercise. Okay, is it clear? Is it clear? Is it clear, students? Hello, can you hear me?
Akan saya.
Uh-huh. I hope it's clear, na everyone? Okay. Okay, if it is clear, then Pablo Klang, can you hear me?
Yes, ma'am.
Okay. So in deep vein thrombosis, what occurs? I mean, what happened?
It mainly occur in the deep veins.
Hmm. Anything else?
Oh,
What abnormalities is going on in this deep vein thrombosis?
normal blood flow.
What abnormalities I said? Obviously, it's not normal, right? This deep vein thrombosis,
Deep
it's not
vein
normal.
thrombosis.
It's not normal, right? So what will happen
Yes,
inside it?
the blood clot occur in the leg portion.
In the portion. In which portion?
Leg portion.
Huh?
Thigh portion.
Okay, means lower limb, right? Okay.
Yes, ma'am.
Okay, Vishal. Vishal. Vishal Kalita. Okay, Darshana.
मैम
हाँ, ओके। क्या क्या सिम्टम्स मिलेगा डीबीटी में? अगर एक इंसान का डीबीटी होने से या डीप वेन थ्रोम्बोसिस होने से उसका क्या क्या साइन एंड सिम्टम्स मिलेगा? हाँ, उसको दर्द
हेलो
होगा।
मैम
हाँ, उसका पाँव में दर्द
मैं
होगा।
एक बार
हाँ हाँ,
मैम अच्छी तरह से सुनाई नहीं दे रहा है, एक बार फिर से बोलिएगा प्लीज।
अ, अगर एक इंसान का डीबीटी होने से डीप वेन थ्रोम्बोसिस उसका साइन एंड सिम्टम्स क्या होगा? उसको क्या क्या हो सकता है? उसका पाँव में दर्द होगा या नहीं?
हाँ,
हाँ
पाँव
तो
में दर्द तो पेन होगा।
हाँ, और क्या क्या होगा? और किस जगह में दर्द होगा? कौन सा मसल? मैंने एक मसल का नाम बोला था।
क्लेफ
हाफ मसल, ओके।
मसल।
अच्छा, ठीक है। ओके, जैम नूनू। जैम। जैम नूनू, कैन यू हियर मी? लॉन्गजम नंदीश्वरी। लॉन्गजम नंदीश्वरी चन्नू। चन्नू,
Yes, ma'am.
okay. So apart from swelling, apart from pain and all that, so another some abnormalities you will find in the DVT, right? In the silent symptoms. So can you name that? I have mentioned one thing. Can you say that? Okay, I'll give you a hint. It's PE. Capital P, capital E. Hello?
Yes, ma'am.
Capital P, capital E. What is that? Okay, I'll give you a hint again. It occurs in the lungs. Can you say? Can you say? Okay, who is able?
Pulmonary
Pulmonary. Uh-huh.
Embolism.
Very good. Pulmonary embolism. Okay. Okay. Which person? Which person? Can you hear me? Which person? Okay, Rifen Pale. Rifen Pale. Rudolph. Rudolph.
Yes, ma'am.
Okay, Rudolph, can you tell me the risk factor of DVT? What, I mean, what can be?
Risk factor,
Uh-huh.
obesity,
Obesity.
pregnancy,
Okay.
smoking,
Okay.
immobility,
Okay. Anything else?
and cancer,
Okay. Okay, very
age,
good.
advanced age,
What? What was the last thing that you said?
advanced
Advanced. What?
advanced age,
I didn't get the last one.
the
I didn't.
older people, the
Okay. Elderly people, right? Okay.
yes, ma'am.
Okay. Tumpe Jilen. Okay, then Surajit Kalita. Surajit Kalita. Sengkamchi. Sengkamchi R. Marak. What happened? You guys can't hear me. Okay, Sheetal. Sheetal.
Yes, ma'am.
Okay, how can a person prevent himself or herself from not getting DVT?
Mm, ma'am, wearing comfortable shoes,
Okay, anything else?
physical exercise,
Okay.
exercise for
Ah,
blood outflow,
blood what? For?
outflow.
Okay. For rich in blood circulation, we say that, huh?
Yes, ma'am.
Okay. Anything else? What will a person like avoid?
To
What?
avoid uh, smoking and drinking alcohols.
Okay. Okay then, very good. Okay, I hope every one of you have understood DVT. I hope it's clear. That's for now, I mean today's class.